you ready to master the waves of medical device product development? Well, wax up your surfboard because you are listening to Inspired by Imua. And here is your medical device product development expert, that Hawaiian-hearted hostess who will help you hang 10, Meghan Alonso.
And aloha! You're listening to Inspired by Imua, where we help you master the waves of medical product development. Each week, we interview guests that educate, guide, and inspire to give you and your product the skills you need to hang 10. If this is your first time listening, Imua is spelled I-M-U-A, and it's a Hawaiian word. It means to advance forward with passion despite rough waves. There's plenty of those in the medical product development industry, but keep listening because we've got you covered. So today I have an extra special bonus for those of you listening that are in the midst of product development, and maybe you're an inventor, or you're a healthcare provider, or you're a student, a researcher, anyone that has this great idea or technology that you want to turn into a product, but business is not your sweet spot. You don't have an MBA and you're just kind of wondering, okay, I'm the idea generator here. What do I do from here? Or what are some ways that I can really strengthen my business? So I have a bonus business blueprint for you available, and keep listening. I'm going to tell you how to get your hands on it as we go through this training. I want you to pay attention. So a lot of you know that I recently moved to the greater DC area, I think as of Tuesday. So when this goes live, that will be 3 weeks since we've been in our new place. So we've made a lot of progress. I promise I got rid of all those boxes you saw in the video. Actually, I think there's just 4 over there now. So that's great. We've made a lot of headway. And I have some really awesome friends here with an organization called AdvaMed. Supposedly you've probably heard of them. And they're a group of advocates for our industry here in Washington, D.C. So they're pushing for a lot of great things in our industry that we have to get through Capitol Hill and anything there that benefits us. So speaking of that, there's a lot of things in politics this week that pertain especially to our industry. On the tip of that is the repeal of the ACA. But wrapped in with that is the proposed repeal of the ACA and this proposed repeal of the medical device tax. So just to recap what this is it was introduced in 2013, and there's a 2.3% tax on innovation. So if you're developing a product, bringing a new one to market, that product is taxed to fund the ACA. And why this has been such a pain point for our industry is because the companies were taxed even if they were pre-revenue. So if you're working on a product, you have to register with the FDA as a medical device manufacturer. Hey, I don't have a product on the market yet, still in R&D. Hey, we don't care, you're still taxed. Well, that has been a big barrier for people, and there's been a lot of pushback with groups like AdvaMed. And because of that pushback, this has been suspended for 2016 and 2017. But a lot of people are talking about it right now because we don't know what's going to happen for 2018. So what I want to get into today is the repeal of the medical device tax, the good, the bad, and is there an ugly? So we'll start out with the good stuff. And I guess I kind of hinted at that saying that it has been suspended for 2016 and 2017. So that has been some good. Now I have a little tidbit here from the CEO of AdvaMed, Scott Whitaker, and he's been working with the Ways and Means Committee for just moving forward to permanently repeal this, not just keeping it suspended. And here's some other good points. So Douglas Holtz-Eakin, which is the former congressional budget chief, he now works with a group called the American Action Forum, and they're more of a GOP think tank. And he estimates that this repeal will do a lot of good things for our industry. So he's estimating restoration of about 30,000 jobs. So 30,000 jobs have been kind of hanging in the wind here, not necessarily knowing what's going to happen. And we'll save those 30,000 American jobs if this is, in fact, repealed. Now, the other thing is this is going to prevent a loss of 25,000 jobs. And what he means by that is if this is not repealed, then those jobs are going to be overseas. So if we're taxed on R&D over here, then by all means, let's do R&D overseas and just have it over there. So the jobs that were here are now over there. We can keep 25,000 jobs in our industry if this is repealed. So now I've got some cool statistics for you from the International Trade Association. All this you can find on just trade.gov. But the US leads the world in medical product development. So 45% of the world's medical products are produced right here in the US. And another good thing about that is that these jobs all the salaries are 15% higher than other manufacturing industries. So I guess if a company were to move R&D overseas and someone says, okay, well, I'm not going to move overseas to keep my job, I'm just going to get a job in a different industry. So maybe, hey, there's an aerospace job for me. They would take a 15% pay cut, what that means. So it is really advantageous of us to keep all the production here in the US. And in order to do that, we like not being taxed on that. So I know I mentioned this before, the bonus for you guys. So it's a bonus business blueprint if you didn't hear earlier. So this is for all of you guys that are working on product development. This can be you haven't started on your idea yet, or this can be you're pretty late in the game. And just business is not your particular area of expertise. You're an engineer, you're an inventor, you're a scientist or a researcher, and you're really passionate about your technology and you need solid business strategies around it. You want to structure your business to keep it going despite everything that's going on in our political world. You still want to keep your business nimble enough to just go with the flow of these changes. You want that bonus business blueprint. So you can get your hands on that if you go to my website. So if you go to imua-services.com/blueprint. And Imua is spelled IMUA. So imua-services.com/blueprint. You can get it there. So I covered the good. I'm going to get into the bad. Now, mostly, I would say the repeal of the medical device tax is it's not a good thing for our industry. It's a great thing for our industry, but there are some bads. So if you are in the women's healthcare space and the Affordable Care Act is repealed, Planned Parenthood might suffer some consequences from that. They might lose some funding. So if you have any women's healthcare products that people are accessing, like an IUD, for instance, then that would cut down on some of that distribution, and that would probably shrink your profit margins a little bit. So watch out for that. And now this is not necessarily related to the medical device tax itself, but there's something called a border adjustment. And Trump was originally against this, but he's warming up to the idea. So we want to watch it. We want to see what he does. And what this is, it's not a tax, but it's tax breaks. So the border adjustment is where if you're a company in America and you're shipping products to other countries, you get a tax break because you're exporting, you're helping our economy and growing our stronghold in other countries. But there's currently tax breaks for companies that are importing goods, and those are going to go away. So if that's the case, we look at companies outside our industry, like the big box stores, anything like Walmart, Target, Best Buy, all of those. That would be an example of retailers that suffer in that case. And that's not as much as our case. The US actually exports, I'm going back to some stats here from the International Trade Association. So the US actually exports $43 billion of medical products each year. Now, I mentioned before that we have a stronghold of producing 45% of the market. So that represents 43 billion. And that's a broad category. So I'm going to kind of break down what exactly that is. So that's everything from in vitro diagnostics to electromedical devices, irradiation, we've got surgical and medical instruments, surgical appliances and supplies, dental equipment and supplies, and ophthalmic goods. So if you're exporting, then this border adjustment is really going to benefit you because you're going to get some tax breaks. However, it is not all sunshine and rainbows here. This is where another part of the bad comes into play. A lot of times politics is like whack-a-mole. Like one problem is fixed over here, but then there's another one that pops up over there. So you got to look at it in a whole. So if you're developing products based here out of the US, hey, that's great. You get this tax break. But as strong as US manufacturing is, and it's growing even more, we don't manufacture everything here. So a lot of these components that go into your devices are actually being imported. And so that cost is going to rise. We don't manufacture really anymore. We don't do controllers here or wire harnesses here or PCB boards. A lot of this stuff that it's just so ingrained in Asian countries. The infrastructure is set up, the cost is set up. It's just not worth it to do it here. So those costs are going to go up. Therefore, the costs of goods in our devices are going to go up. And we either can just eat it or we can pass it along to the end users or whoever's buying our products. So now I want to get into, is there an ugly? And I don't really think there's an ugly. I'm going to get into one ugly thing towards the end here. But I think if the medical device tax is repealed, it definitely makes it easier on startup companies and we're not taxed from the get-go. And then it's also easier for larger companies to acquire these startups because I guess the pickings are good. If you have a lot more companies innovating, then there's a lot to choose from as far as acquisition. So you're going to see a lot more promising technologies that either round out your portfolio as a larger company or say, hey, that one could be a potential threat to me. I'm going to acquire it right now before it becomes a threat. Now, on the investment front, this looks really good for US companies as far as, hey, I know they're saving a lot of money. They're going to dump those costs that they would have to pay on the medical device tax. They're going to dump all that into R&D. That's great. I'm going to invest in this company. So if you are a publicly traded medical device company, that's going to be great for you. Although here's where it gets ugly, because if you are a US-based company, but you're developing overseas right now. So if you have your manufacturing, whether this is your own manufacturing plants or if you're leveraging an overseas contract manufacturer, and then you bring those goods into the US, that's where that border adjustment may get you. So I just want you to watch out for that. That is an ugly part. So I will try to stay a lot more involved in this, and I really want to revisit this later. And I've been meaning to get down to see all my friends at AdvaMed. So I'll do that and I'll go interview AdvaMed and I'll just touch base on some of these topics and I'll keep you informed as to what goes on here near the Beltway. I'm getting used to all of our slang terms. So I do want to touch on that bonus again. You can get your hands on that bonus business blueprint. You like my alliteration with bees there? I think it's pretty cool. So this is for anyone developing products, and you can be really early stage, like just have an idea, or you can be pretty mature in clinical trials, or maybe your product is almost to market, you're transitioning it to manufacturing. This is for you that you're an expert in your idea. You're an expert in your technology. Maybe you're a PhD or an MD, or just you have an honorary PhD because you've been around your device for so long, you know it inside and out, but you don't necessarily have an MBA and you're a little bit unsure about the business side of things. You want your business strategy, you want your business plan to be rock solid. And that way, no matter what happens in the political environment or what happens in the economy or natural disasters or anything, you have a solid business strategy that just keeps you moving forward and being a profitable company, essentially. So you can get your hands on this bonus training by going to imua-services.com/blueprint. Imua is spelled IMUA. So again, that's imua-services.com /blueprint. So I hope that you're downloading that business blueprint if that's who you are. And I will catch you on next week's episode. So last week I did a live video. So what I did is I actually recorded on video myself doing the podcast on Facebook Live. I encourage you to follow us on Facebook. It's just facebook.com/Imua Services. Find us on there. I will keep you up to date the next time I do that. I thought about it today, but I didn't plan it in advance. I want you guys to be there live with me. So I've got to let you know when that happens. So follow us on Facebook so you know, and I'll help you cheat a little bit. I'll also send out some emails too. Anyway, so I will catch you on the next episode. And until then, Imua.
Mahalo for joining us. If you're new to riding the waves of medical device product development, or if you've been in development for a while already, Inspired by Imua is here to surf with you. Want to be a master of the waves? Text HANG10, that's HANGTEN, to 44222. We'll send you the most common wipeouts companies make in product development so you can avoid them and reach master wave status. Again, that's HANG10 to 44222. We publish a new episode every Tuesday, so catch us at inspiredbyimua.com. Imua!